Yeah, so we have a number of different things at Metabolic Mind that can be helpful. One is what we call our Think Smart platform, and that is where we have just hundreds of people who are sharing their stories and their journeys. So if you want to know what's worked for other people, to maybe learn from them, or if you're someone who has seen benefits, then sharing your story on Think Smart will help others. So that's one really good place to start.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to be talking about a topic that I myself am very, very interested in. I think it's something that we don't talk enough about. The general public is not aware what an impact your diet can have on your mental health. So today we have with us on the line Bret Scher, MD. Bret is the host of the Metabolic Mind YouTube channel and podcast. He's a board-certified cardiologist, lipidologist, and leading expert in therapeutic uses of metabolic therapies, including ketogenic diets. He previously was the medical director at dietdoctor.com, which is an online platform promoting improving metabolic health through low-carb nutrition, where he was a content creator and a medical reviewer. And earlier in his career, he worked as a cardiologist in San Diego. And he spent most of his 20-year career as a preventative cardiologist, which I really love, helping people improve their metabolic health and preventing heart disease using low-carb nutrition and lifestyle interventions. Bret, thank you so much for joining us here today.
Hey, Taylor, it's a pleasure to be here. Thanks so much for having me.
Yeah, this is such an important topic. And I love when I see medical doctors actually learning about this stuff and teaching this stuff and now coming out and really spreading awareness to the general public about this. So maybe let's just start with a brief background. How did you get, interested in this information and get on this journey yourself?
Yeah, I mean, it's interesting when you talk about doctors learning it, sure don't learn it in medical school or residency or formal training, which is kind of unfortunate. But, as you said in my bio, I'm a cardiologist. I always wanted to focus on prevention. I mean, really utilizing lifestyle. When you get out into regular practice and you see the impact that you have with the general eat less, move more, low fat approach, it's minimal. I mean, it's really frustrating that you have such little impact with your patients. So I just said, what else can I do? There's got to be something else I can do. So I started a little wellness center called Boundless Health with a friend of mine who's a great health coach and personal trainer. And luckily, he was very knowledgeable about ketogenic diets and low carb diets. And so he's the one who sort of introduced me to it. Again, not my training, right? Mm-hmm. And then from there, I just went down the rabbit hole and was so surprised that there actually was research that already existed about using ketogenic and low carb interventions for metabolic health, for type 2 diabetes, for weight loss. And all of a sudden it just opened my eyes in two different ways. One, just how impressed I was at how effective this was at helping my patients where, quote unquote, nothing else, they tried everything and nothing else had helped. But two, the sort of sense of frustration. Like, why did I have to learn this from my buddy who's a personal trainer and a health coach when I spent how many years of formal education learning to take care of people and help people lead healthier lives? Like, that didn't make sense to me. So that sort of started me on this whole journey to really just want to be a megaphone to let people know that low carb and ketogenic diets as part of metabolic therapies are medical interventions. They're safe and effective, and they should be considered. Doesn't mean everybody needs to be on it, but they absolutely need to be widespread, taught, and considered to help people live healthier lives.
Amazing. And Metabolic Mind, this is actually a nonprofit. Tell us a little bit about what is Metabolic Mind?
Yeah. So actually the transition from Diet Doctor then to Metabolic Mind was really sort of now focusing predominantly on mental health, on brain-based disorders. So Metabolic Mind is a nonprofit started by Jan and Dave Bazuki, a very philanthropic family, fortunately. But their son, Matt, has bipolar disorder. And you can go to Metabolic Mind, our website, their family story is on there. And it is a dramatic family story. I mean, here's this family with a lot of resources and very intelligent family. And they could not help their son get well. He was in and out of treatment programs. He was in and out of homelessness. And even when he was home and treated, he didn't have his life back. He was numb. He was, he couldn't play chess anymore. He couldn't live independently. And you hear Jan say she felt she would never get her son back, but she wasn't going to accept that. So she kept digging and kept digging, and they were lucky enough to get connected with Dr. Chris Palmer, who helped Matt start on a ketogenic diet, and everything changed from there. And now, she says her son is back, and she's so thankful for that. And she doesn't want anybody to have to go through all the countless hours she did trying to find this information, because Matt's now living independently and playing chess and working. And as he's joked before, saying he's the most sane of all his friends, he's just doing fantastic. And so that's now Metabolic Mind exists to try and provide this information for people, for the clinicians, to give them, the free CME, to give them the evidence-based information, to the patients, the individuals living with mental illness, their loved ones, what this could mean for them, how they could change their lives. So yeah, it's been an amazing run. I've been there for about 3 years now. And just to see the lives we've helped, the people we've touched, and the clinical education that we've created is pretty remarkable when you get a dedicated family like this who wants to change the world and they're actually doing it.
Yeah. And I sometimes wonder, like, how many of the diagnosis out there, right, whether it be depression or bipolar or things like that, right, how many of those, if the person was eating a different type of diet, right, how much of is it, right? Because when you eat garbage and you feel like garbage and you're in a bad mood, right, and then you can get a diagnosis, versus what if you were exercising and eating right and doing all the right things, would you still get that same diagnosis? I always think about a lot of stuff like that,
Yeah, and it's a really fair question. It's hard to say there's like one cause, right? If you just didn't eat potato chips, you'd be fine, right? You didn't eat your pizza, you'd be fine. It's not that simplistic, but it's clear that there's this connection between metabolic health and mental health, and that with poor metabolic health, with insulin resistance in the brain for sure, with the neurons in the brain and the mitochondria not able to transform energy efficiently, that can manifest as a number of different symptoms. Now, what's interesting is for some, it could be depression. For some, it could be schizophrenia and psychosis. For some, it could be ADHD. For some, it could be bipolar disorder, right? The brain, or seizures or dementia, right? The brain can manifest in different ways. And again, it's not that that's the only contributing cause, right? There are other epigenetic reasons for the way symptoms may present. But it's becoming clear by reversing that metabolic dysfunction, by providing the brain with this alternative fuel source in ketones, you can remarkably diminish, if not completely resolve, all of those symptoms. So it is pretty dramatic what we've seen and what the research is starting to show. So, we're at the infancy of this field of metabolic psychiatry, but even now in its infancy, it's remarkable how many people it's helped. And the way the research is piling up is starting to corroborate it.
Yeah. What are some of those kind of interesting pieces of research maybe that we could share with people?
Yeah. So it really started, I guess you could say, with Albert Denon, the French psychiatrist, who's a psychiatrist, not a researcher initially, but he had a number of his patients who weren't getting better. He didn't know anything about a ketogenic diet until a family member of his used a ketogenic diet to treat a different neurologic condition. And then he said, I wonder if this would work with my patients. So he actually took about 30 of his patients, put them in the hospital. The only thing he changed was their diet. The only thing he did was fed them a ketogenic diet, and all of them improved, with almost half of them going into remission, and 70% of them or so reducing the amount of medications they were taking. I mean, it was remarkable. And yeah, it's not a randomized controlled trial. It's not a prospective study, but just for him to show that impact. And then from there, Shabani Sethi out of Stanford published a pilot study of 20 or so patients that, again, all she did was put them on a ketogenic diet. They were getting their regular care. The only change she made was a ketogenic diet, and their metabolic and mental benefits were remarkable. Dr. Ian Campbell did something similar out in the UK. And now Dr. Jeff Volek with the KIND trial out of Ohio State on college kids, put them on a ketogenic diet and who had severe depression. 100% of them improved, with an average improvement of about 70% on their depression scores, which is remarkable. I mean, on the antidepressant trials, you usually see about half improve by about 50%, which is not nothing, but this was much, much more profound than that. So we have all of these resources on the resource tab of our Metabolic Mind website. So I encourage people to go check them out there with links to the studies. But that's some of the emerging evidence. And then we also have a page that shows all the ongoing studies, which is I forget at this point, it keeps getting updated. It's like 20 plus studies that are ongoing, many of which randomized controlled trials over various diagnoses. So there's definitely a tidal wave of research that's going to be coming. But the question that I always ask, if you're someone living with one of these conditions or a family member of someone, do you need any more research at this point? Because it's changing your diet. It's improving your diet. It's a natural physiologic state of ketosis. This isn't something unnatural that a manufactured drug or chemical or something. This is a completely natural state. So why wouldn't you do it? Now, if you're using it to treat a condition, it's really thought of as a medical intervention, though, and has to be done safely. And so we always recommend working with a clinician, whether it's a coach or a dietitian or a doctor, about instituting it properly. But that's, again, a lot of the information we want to provide with Metabolic Mind, because people can change their lives.
That's great. Yeah. And the website is metabolicmind.org. I'm sure we'll talk more about it as well as we proceed. But yeah, a lot of resources there. Highly encourage people to check that out. Yeah. So obviously there's huge benefits here, even just for the regular person, right? Everyone wants to be happier, right? Even if you don't have some really bad diagnosis, most people want to feel better, want to feel happier. And we see, right, like the Ohio State thing, and college students who are probably eating like garbage, you take them, you put them on a good diet, of course their depression is going to get better. To me, it's pretty obvious. A lot of people don't really make that connection. So I guess let's go maybe like deeper in then for our listeners, right? Maybe someone who doesn't have a severe diagnosis, but maybe they just don't feel their best. Maybe they're a little bit overweight. Maybe they're just feeling a lack of energy. They don't feel like they should be. What are some of the core principles here? And does it have to be a strict ketogenic diet? How deep are we going with the ketogenic thing?
Yeah, all great questions. And so to answer this question, though, we got to sort of step out of the research, backed science, and go more towards the clinical experience and the individual experience, because there haven't been a lot of studies to address this. But, there's absolutely no question, just eating better and improving your metabolic health, getting rid of the junk food, reducing the carbohydrates, not necessarily all the way to a ketogenic diet, eating whole foods that come from the ground and from animals, and that's it. That's going to make a lot of people, just about everybody, feel better. No question. You're going to sleep better. You're going to have more energy. You're going to think better. Now, what's interesting, though, is what happens when you take that next step to ketosis? Because the brain can use ketones very efficiently for fuel. And how does that change things? And so you hear people say, I could just think better. I was more alert. Better executive functioning, right? And these aren't research-backed claims. These are just individual experience. So some people are going to experience that. So personally, when I'm working with patients, I frequently will want them to at least try ketosis, see what it feels like. It may not be right for everybody, but like you're hinting at, no question, just improving the way you eat, getting off the standard American diet, reducing your carbs, eating whole foods, that's going to make a difference in how everybody feels.
Yeah, I think some of the things, though, like I still hear a lot of people these days, especially like in California, where there's a lot of, vegans, they'll say, oh, vegan diet is the best still, right? Mm-hmm. My issue with that is that, and by the way, if people are doing vegan for whatever, reasons of animal reasons or, stuff like that, totally respect that. My problem is just personally speaking for myself. When I went vegan, I found I was eating tons of carbs, right? Fruits and bread and pasta and stuff like that. And then I got really inflamed. I felt really awful. I just couldn't get full without the protein. It was really difficult for me to get satiated and full. And I just felt like I kept eating more and more. And I felt like probably it was pretty high carb. And that's why it necessarily didn't work for me. So I think sometimes people say, yeah, just eat plant-based, or, vegan is the best, or something like that. And it sounds good when you say plant-based and everything is from the ground and stuff like that. But you also have to be careful, because bread is vegan, pasta is vegan. There's a lot of stuff that's vegan that's not necessarily healthy, right?
100%. 100%. Couldn't agree more. And it comes down to the whole foods approach. And how do you define whole foods? Bread and pasta, to me, are not whole foods. Those are processed foods. Right. Some of the biggest junk food diets out there are vegan diets, but that certainly doesn't mean all vegan diets are junk food. A whole foods vegan diet can be healthy for some people as long as you're supplementing. I mean, we have to be honest, it's a nutritionally deficient diet, but you can supplement your way around that. That's fine. and ensure you're getting enough protein. And you can eat a keto vegan diet. You can eat a keto vegetarian diet if you wanted, right? It's one of the nice things about a keto diet. To get in the state of ketosis could take almost any dietary form. So that's perfectly fine. Yeah, but I think it's crucial that people get adequate protein, which is not the 0.8 grams per kilogram that the RDA says it is, right? That's the minimum to prevent protein deficiency, essentially. Most people want to be more around the 1.5 grams per kilo, so almost twice what the RDA is.
What does that work out for pounds of body weight?
It's like 0.8 or like 0.7, 0.8, somewhere around there.
So I'm about 185 pounds, and I try to get about at least 150 grams of protein, somewhere around there. I usually feel about right.
Yeah. So that level of protein, which some refer to as a high protein diet, which is absolutely inaccurate. I mean, that's just an adequate protein diet or a moderate protein diet. That's gonna be more optimal for muscle synthesis, for lean muscle, for metabolic health, for satiety, for energy, for all those types of things. Is likely going to help with that, right? So I think designing your protein your protein goals, and then you're making sure your carbs come from whole food sources and are somewhat limited, and then filling the rest in with fat. So that's where the delineation comes. Are you going to be keto, or are you going to be just moderate low carb, liberal low carb, whatever, as long as you're focusing on the whole food carb sources? I mean, that's the step everybody needs to take. Now, it's easy to say and a lot harder to do, especially in this ultra processed world with, convenience, junk food all over the place, super inexpensive, super accessible. And with this notion, like you were saying before, this belief that it's the healthiest diet is a plant-based, higher carb, low fat diet. If you have that belief, you're really kind of destined to fail, because most people are going to be hungry and have cravings. And then that's why it doesn't work. And we're human beings. We have emotions, we have feelings, we have likes, we have dislikes, we have cravings. We have to address that. And if you don't address that, you are destined to fail, and it's not your fault. It's your biology getting hijacked.
Yeah. Speaking, because depression is such a widespread topic and affects really everyone to some certain extent for certain periods of time, right? It's such a big topic, and it's not really, and so many people are talking about SSRIs, and now a lot of new information is coming out about how SSRIs can be, really bad for mitochondrial dysfunction and things of that nature. Are there situations where, for example, people say, I have depression, and if they went to a regular psychiatrist or someone, right, they might get put on an SSRI. Is there a different intervention that maybe they could try first if they went to someone like you?
Mm-hmm. Well, so first of all, my clinical practice is actually still a cardiology focused practice. Yeah. So my role in the mental health world is more as an educator and sharing the work of others. Mm-hmm. So what I do hear, though, from people in this field, and people have been practicing for decades, is depression tends to be the most heterogeneous of the bunch, right? There are people who are experiencing symptoms of depression because of a change in their life, some sort of change. And those people might do really well with talk therapy, right? Or with exercise and nutrition as the only treatment. There are others who are experiencing severe depression, major depressive disorder. And those people are the ones who are more likely going to respond to a combined approach, right? With medication plus the lifestyle intervention. So, there's always other things you can do. And that's the problem with medicine in general, that we get into this, this pill will fix it. No, pills don't fix anything. Pills can, well, except for maybe like an antibiotic, right? It's going to actually get rid of the bacteria that's causing the problem. But otherwise, no, they tend to put a Band-Aid on the symptoms without really addressing what's causing it. And that's where metabolic treatments, where, nutrition is the big one we talk about, but sleep, substance abuse, exercise, physical activity, stress management, getting sunlight, all those things contribute, absolutely are important. Nutrition probably being the biggest lever, that and substance abuse, but all of them really contributing. So regardless of whether you're taking a medication or not, they should be part of the treatment program.
Yeah. I want to ask you this before I forget. It's especially since you're a cardiologist, perfect question. I've seen this with myself and with others in the past when I've gone on like a ketogenic, kind of high fat, low carb, ketogenic diet, your cholesterol can go up in some
Hmm.
cases, maybe not too uncommon on a ketogenic diet. Now, where do you land? I guess this is the old, we've had people on this podcast as well who have said, no, the whole statins and cholesterol thing is way overblown. It's actually more about inflammation that causes heart disease. And even if your cholesterol numbers are high, as long as you have low inflammation and, kind of things of that nature. I know it's a lot more nuanced and kind of difficult for a medical doctor to answer and also cover all his own bases. But I'm curious what your thoughts are on your proponent of the ketogenic diet.
Yeah.
When you go on the ketogenic diet, many people may see cholesterol go up.
Yeah. So let me introduce, address that first.
Yeah.
And, if you look at the research for using ketogenic diets for weight loss or for type 2 diabetes, it is clear that the vast majority of the people do not see a rise in their LDL. And I think that's the first point that people need to realize. The research supports this. You do not see a rise in your LDL. Most people do not, if you're starting a ketogenic diet for weight loss or for type 2 diabetes. Now, the people who are more likely to see a rise in their LDL are those who are leaner,
Yes.
more physically active, more metabolically healthy, and not just like the lean mass hyper responders that we hear about, but LDL going up by 10%, 15%, 20%, something like that. Now, so it can happen. But the first thing is nobody, and I mean nobody, should avoid a keto diet because they think their LDL may go up. It is the easiest blood test in the world to get. So you can test whether it goes up or not. There's no need to be afraid of it or guess if it's going to go up. You can absolutely test. And a short-term rise in LDL will hurt nobody, right? So if you're talking about like days, weeks, whatever, you can even argue if a long-term rise will hurt anybody, but that's so we'll get to that. But so most people, they're not going to go up. Now, the second thing to consider is, okay, so the LDL can go up in some people, but what else happens? And usually blood pressure goes down, blood sugar and insulin goes down, visceral fat goes down, inflammation goes down. And cardiac risk is a multifactorial component. We tend to focus on LDL and talk most about LDL because that's the way medical practice is geared. There's a drug for it. It's easy. There's lots of research on it, mostly drug-sponsored research, but it's there. And there is no question, if you've had a heart attack, if you have heart disease, you can get a small benefit for risk of future heart attacks with lowering LDL. That is incontrovertible, right? That, or whatever the word is, like that evidence exists. Now, the question is, how small and at what risk and for whom? But the evidence does exist. You just have to dial it down a little bit more. So for most people who are primary prevention or lower risk, if I'm improving their metabolic health, which, by the way, type 2 diabetes, metabolic syndrome, insulin resistance, on average is going to be a higher risk factor than just elevated LDL. So I would rather treat that. And if that means a small rise in the LDL, that can be a net benefit. And also, if you're getting significant benefits from a ketogenic diet, whether it's reversing bipolar disorder, reversing type 2 diabetes, or putting those into remission, or getting rid of all your visceral fat, or feeling better than you've ever felt before, and you have to treat someone's LDL to maintain those benefits, that's not the end of the world either. That's an acceptable compromise, right? So there's so many different things, but we like to talk about it as LDL doesn't matter, or any rise in LDL is immediately dangerous, and neither one is true. But let's meet in the middle. And the problem is it takes nuance, it takes a personalized approach, and that's more challenging to talk about, and that's more challenging to practice in medicine, but it's the right thing to do.
Interesting. Yeah. So for people who already have maybe diabetes or high blood sugar levels, pre-diabetes, diabetes, actually going on ketogenic diet can not only potentially bring down those numbers, in many cases reversing the diabetes, but that is not shown to increase LDL in most
Correct.
people. That's
Correct.
great.
And actually, there's one study that showed a 10% increase in LDL, but a 12% reduction in cardiac risk. right? So a lot of doctors like just get baffled by that. Wait, how can LDL go up by 10%, but cardiac risk go down, calculated cardiac risk go down? And it's because triglycerides go down, HDL goes up, blood pressure goes down, so the metabolic benefits that you see. And in that same study, ApoB, which is actually a more accurate measurement for cholesterol and potential risk from cholesterol, ApoB did not go up, even though LDL went up. And that just shows that you're reducing your small particles, increasing your big particles, reducing your VLDL. So you're having some beneficial changes. So, it's this level of nuance, which unfortunately gets lost so much in this discussion of sound bites.
Yeah, yeah. What do you think? Why do more cardiologists or just regular doctors not even check for ApoB on the blood test? I literally just had a friend I was with over the last weekend, and he's like, "Yeah, I have a concierge doctor," and he's like, and we were talking about how so many of them just only test total cholesterol, LDL, HDL, and not ApoB. And he said, "Oh, let me pull up my concierge doctor. I pay a lot of money for this concierge doctor." So then he pulls it up, and no ApoB there. If it's a better marker, why are we not testing that frequently?
Yeah. Well, one, because it's not part of the standard lipid profile, right? You check the box and it's not in that. So it's an extra lab test that you have to check the box. So as simple as that, right? Just checking the box. Also, almost all of the guidelines and the discussion is still around LDL. So it hasn't really leaked into the common lexicon or the common discussion of ApoB. And so when you say, what's a high LDL or, what's a high level, you're talking about LDL, you're not talking about ApoB the majority of the time, unfortunately. So yeah, so that's really why I think.
Yeah. Unfortunate. We got to get a box. We got to get the box default checked on that one.
But it's the perfect example, right? At Metabolic Mind, we've seen so many patients who, they've had treatment resistant bipolar disorder, treatment-resistant schizophrenia, and they go on a ketogenic diet, and now their symptoms are gone, and they feel better than they've ever felt before, and their LDL goes up, and their doctor tells them they have to stop their diet. Like, what world is that the right approach, to tell them to stop the one thing that has treated their most disabling symptom because of an abnormal blood test? To me, that's pretty baffling. And the other point I really like to make is LDL is not the disease. Vascular disease is the disease. And we have imaging tests for that. We can do calcium scores. We can do ultrasounds of the carotid. We can do CT angiograms in some people. They can be expensive and hard to get, but if you can get them, they can be incredibly, they can give a lot of information. So, because of one abnormal blood test, don't throw everything away, but rather evaluate it critically.
Yeah, I think it's great what you mentioned, these other more deeper tests. If you can, obviously, if it's cost effective for you, some people maybe don't have the resources, but if you do, to go get that ultrasound and get that imaging and get the ApoB and some other further tests that would kind of give you better numbers to work with there, I think is really important. Because again, there's a lot, I want to get back to Metabolic Mind as well in a minute, but it is interesting how there's a lot of people who would just like get total cholesterol, HDL, LDL, prescription, statins. Now you're on a statin. Some people have different viewpoints on that. I'd be curious to know, do you see lots of potential negative side effects from statins?
Sure. Yeah. Statins definitely present risk for side effects, and they have benefit for people with significant amounts of plaque or who have had heart disease or strokes, et cetera. So you have to balance that. As with any medication, you have to balance the potential benefits for the risks. And that's why someone who's primary prevention with no evidence of plaque, I'm a lot less likely to prescribe a statin than someone who's had a heart attack, who's had bypass, who's had a stent. Those are completely different.
That's right. That's absolutely right. I love to hear that. I love to hear someone going a little deeper. Hey, let's actually do the imaging. If the imaging looks clear, just because you have a slightly elevated, LDL or cholesterol number, you can potentially avoid side effects of statins, and not also have doctors telling people, hey, don't follow this diet. It's providing benefits in 9 out of 10 categories, but this one category, it's not. So you mentioned bipolar, you mentioned schizophrenia, we know diabetes, depression, right? These are all some of the top ones. Am I missing any that could really benefit from this type of diet?
Yeah. So what's interesting, that's where a lot of the research is right now. But when you talk about clinical experience or patients sharing their experience, we hear the gamut: OCD, ADHD, PTSD, autism spectrum disorder, substance use disorder, you know, cognitive impairment. As I like to say, the brain likes ketones. It's a very general, non-scientific thing to say, but it seems to be true. When you provide ketones to the brain and improve metabolic health, the brain functions better. And that's why it's a transdiagnostic treatment. It's not just one diagnosis. And
Mhm.
you see that in the body, the systemically as well, right? Whether it's fatty liver, whether it's PCOS, whether it's diabetes, um, or just visceral fat in general, right? You see so many different impacts, and it's not because of one thing, right? We can come from this from the drug perspective. We're going to design this drug to have this one effect, which they never do have one effect, but that's the thinking, to have this one effect that's going to target this one disease. This is completely different, right? This is completely changing your physiology, your metabolism, and providing a different fuel source for your brain, which is going to have multiple mechanisms and therefore impact multiple different so-called diseases.
Right. What are so people listening now, they want to avoid kind of the high carb processed foods. That's, when I say to people recently, I was at a dinner and I said, they were all eating the bread. They were like, oh, this bread is so good. I said, yeah, haven't had bread in over 10 years. And they're like, what? What? You
Mhm.
haven't had bread? I'm like, no, yeah. Why would I eat bread? It's like going to cause inflammation in my body. I don't, people look at me like I'm crazy, but bread, pasta, same thing. What other food, like, what about seed oils that maybe are seed oils are not necessarily high in carb. They're found in a lot of things. Are seed oils still compatible with the kind of keto diet that you guys recommend?
So, in general, the general statement is yes, seed oils are compatible with a ketogenic diet. They're fat. But if you're talking about a whole foods, minimally processed ketogenic diet, then absolutely not. I mean, they are a highly processed food, using chemicals and industry tools to produce them. So they are not part of a whole foods, minimally processed ketogenic diet. And really, I mean, for me, I get frustrated with the whole discussion over seed oils, because the only reason we're even talking about it is because of this fear of saturated fat. If we didn't have a fear of saturated fat, seed oils wouldn't exist. I mean, that's the only reason they exist, I think.
Mm.
So yeah, I think we need to kind of get past that.
Maybe
But
because
look,
they're cheaper too. I would imagine that, like, probably cheaper than
yeah,
yeah.
I mean, cheaper than olive oil and avocado oil, but are they cheaper than butter? I don't know. I don't think they would be cheaper than butter. I'm not sure, but
Mm.
um, yeah. And so, look, I don't think anybody should really be using seed oils at home.
So you're a
You know,
cardiologist and you're good with saturated fats.
absolutely, absolutely. So you know, this is the other again level of nuance. We try and say saturated fats are bad first, as if saturated fats are one thing, which they are not. There are multiple different saturated fats. Food that has saturated fat is never 100% saturated fat. Even red meat, which is sort of the poster child for saturated fat, is tends to have more monounsaturated fat a lot of the times, right? So there's that, but also the dietary matrix is what matters. The evidence, the quote unquote evidence, which is mostly nutritional epidemiology studies against saturated fat, is that these people who eat more saturated fat compared to less are more likely to have type 2 diabetes or a heart attack or die younger. But they also smoke more and exercise less and eat more calories in general and eat more carbs. And there's no way a study can control for all those things. So it is worse than no evidence, because it's bad evidence if we're going to treat it as definitive evidence. And that it can be hypothesis generating, but by no means answer giving. And that's unfortunately the way we've treated it. I mean, show me any evidence that saturated fat is harmful in someone who's eating a low carb diet, who is just naturally managing their calories because it's a satiating diet and improving their metabolic health and their blood pressure and their type 2 diabetes, et cetera, et cetera. Where is any evidence that saturated fat is harmful? And then also the other point about the saturated fat debate is, are you talking about a lasagna with all the noodles and sugar in the sauce, which is considered saturated fat in the study? Or are you talking about, a Cobb salad that's got, chicken and bacon and some cheese in it, which has saturated fat, right? Your body's going to see those very differently, but the study doesn't.
Yeah, I always give this example. It's like if you went to McDonald's and you got the supersized meal or whatever, and people are like, oh, the red meat is so bad for you. But it's like, wait, the red meat might be the healthiest part of this Happy
100%,
Meal. You got French
100%.
fries, you got soda, you got the processed bun that the burger
Yeah.
comes on. If all you ate was the red meat and threw out
Yeah.
everything else, right? And that's the thing. It's like, oh yeah, people who have red meat, had a higher thing of heart disease. Well, maybe because they were eating the French fries and the soda and the bread. Where's the study of people who ate red meat with, a low carb, paleo style, keto style
Exactly.
diet? Yeah.
Exactly. Well, I remember reading something, this was a while ago, something about like Subway wasn't legally allowed to call their bread because there was so much junk in it and so many chemicals and what that they couldn't legally call it. I don't know if that's true or not. I remember reading something about that. I was like, yeah, that makes sense. But yet they're going to blame the stuff that's in the sandwich rather than the bread itself. Yeah.
Right. Exactly. So what does your normal diet look like? What does a normal day of eating look like for you?
Well, so I'll either eat 2 meals a day or 3 meals a day. It just kind of depends on the day. If I'm having breakfast, it's usually 3 eggs with like some smoked salmon and leftover veggies and cheese.
Mm-hmm.
My second meal, or if sometimes it's the first meal, is usually like I use Cobb salad as an example because I eat a lot of Cobb salads. I think those are great. It's so funny when you think about salads that the traditional salad is like lettuce and then maybe some cucumbers and tomatoes, and that's your salad. Like that's nothing. That has zero nutrition. But a salad with lots of chicken or steak and bacon and cheese, and like that's a salad. And avocado, that's a salad. And then for dinner, I'll have steak, ground beef, chicken, fish, some version of that with a lot of steamed or roasted veggies and avocado, and that's my dinner. So I guess I'm lucky in the way where I don't need really complicated, ornate kind of recipes and things like that. I can perfectly happy with a simple diet like that. But I don't know why it needs to be different than that. I can understand people who've never eaten this way and it's foreign to eating this way. It's a shock. It's totally a shock. And it takes a lot to wrap your brain around it. But once you've been doing it for many, many years, it just makes sense. And there's really no other way to do it.
I agree. I mean, those who have listened for a while know my journey. Back in 2013, I had so much pain and inflammation in my fingers, hands, my arms. And so I finally, after going through so many doctors and chiropractors and trying vegan diet and this diet and that diet, I finally realized inflammation comes from what I put inside my body. And when I started researching low inflammatory diet and found the paleo diet and eliminated the breads and the pasta and the sugars and the processed foods and all that, my inflammation went away. And it wasn't a herniated disc in my back that was causing this inflammation. And it wasn't this or that or the other diagnoses that I got. It was just inflammation from what I was eating. And I say it all the time, even people that have knee pain and back pain and shoulder pain and elbow pain and wrist pain, how much of that, if you actually change your diet and eliminated the bread, the pastas, the fried foods, and all these things, how much of that pain and inflammation could go down?
Yeah, it's a great question. It's a great question. And there are published case reports and some studies showing decreased inflammation, systemic inflammation, which is funny because that's the other thing you hear, right? Saturated fat causes inflammation. Red meat causes inflammation. Well, no, it doesn't. It's weakly associated in it in these very poor quality studies. But within a whole foods, low carb framework, evidence actually shows it causes a decrease in inflammation or is associated with a decrease in inflammation.
Mm-hmm. Mm-hmm. Yeah, this has been great. Tell us a little bit more about like Metabolic Mind, what people can learn from them, who maybe someone has a family member or someone themselves has a certain condition or something. Tell us a little bit about how someone like that could maybe get help.
Yeah, so we have a number of different things at Metabolic Mind that can be helpful. One is what we call our Think Smart platform. And that is where we have just hundreds of people who are sharing their stories and their journeys. So if you want to know what's worked for other people, to maybe learn from them, or if you're someone who has seen benefits, then sharing your story on Think Smart will help others. So that's one really good place to start. The other is just our YouTube page for Metabolic Mind. We just have We have hundreds of videos of interviews and just content videos to help people understand this connection between metabolic and mental health and the utility of metabolic therapies and ketogenic therapies. So there's a wealth of information there where people can learn. And then our website, we share the resources and share, directories of providers, because that's a big question a lot of people have is, well, where can I find someone to help me with this? So we share some directories that other people have where you can find clinicians. And it's, to be honest, it's going to be unlikely that you can just go out and find a psychiatrist practicing metabolic psychiatry. We are definitely trying to change that, and we're seeing some change. But that's where we recommend a well-trained and experienced dietitian or a therapist or a health coach who can help you with the ketogenic part and help communicate with your psychiatrist to make sure you're all on the same team, to make sure it's being done safely and effectively. So we try and provide as many of those resources as we can at Metabolic Mind.
That's amazing. Metabolicmind.org. That would be so amazing if you guys could get a kind of list of psychologists, psychiatrists in each state that would actually, tell people this is part of your get better plan.
Yeah, that's the goal. Yeah.
That's going to be pretty incredible. Hey, one last question I forgot to ask you, fruits. Because fruits can be high carb, but fruits are plant-based, from the earth, all that kind of stuff. What's your opinion on fruits? Do you eat much of them? I mean, they're not really part of a ketogenic diet, right?
Well, they can be. Yeah. I mean, berries tend to be, low sugar fruits, but, in my mind, fruit is dessert. Fruit is a treat. They're sweet and they're a treat. I think where we got into trouble is this concept that fruit is healthy. So therefore it has this health halo, and you can eat as much fruit as you want because it's got phytonutrients and it's completely healthy. And that's where we go overboard. These huge bowls of fruit salad, these fruit smoothies, fruit with every meal. And those carbs certainly add up, especially if you already have metabolic dysfunction, right? If you're completely healthy with great metabolic health and you're very physically active, you're probably not going to notice any difference from those fruits. But that's unfortunately a minority of people. Anybody with any metabolic dysfunction is going to see some detrimental impact from that fruit. But fruit, especially blueberries, are completely compatible with a ketogenic diet. My dessert is frequently some high-fat yogurt or cottage cheese mixed with some blueberries and raspberries and strawberries, and that's a great dessert right there.
Yeah. I stick to berries typically as well. I don't do too much of other fruits, but love the berries as well. Yeah. This is great stuff. So we mentioned the website, metabolicmind.org, YouTube channel, social media stuff. You guys out there?
Yeah. Metabolic Mind at YouTube as well.
Okay.
And on X and in LinkedIn. And I think we're getting TikTok running up now. So we're turning into a social media powerhouse.
Amazing.
I guess. Yeah.
Well, thank you for everything you're doing, Bret. This is amazing stuff. We hopefully this will help spread the word as well. And I think it's really important information. So many people don't realize how much of your mental health comes down to what you put in your body. Obviously, there's other factors as well, like exercise and sunlight and all that good stuff. But this is, I think, probably the biggest thing that impacts, and people don't realize it, right? And I see it with kids, right? I mean, kids just eat so bad these days, the majority of kids in our country. And then, we wonder why they're in a bad mood or why depression is up or why whatever, right? I mean, obviously, there's many other things with the whole social media and phones and things like that as well. But diet, I think, is such a big part of that. I've talked about years ago as well. I believe there was one called the Appleton Food Study where they took all the processed foods out and replaced it with whole food. Wasn't even completely low carb, just removing processed food, replacing it with whole food. And they noticed the behavior of the kids, the scores of the kids acting out went down, all sorts of incredible benefits. So I think whether it's kids, whether it's adults, I think it's very important to do this, to be mindful of this. And we have such a high carb diet. So really spreading this awareness about the low carb is really important. So thank you so much for everything you're doing.
Thank you. Appreciate the opportunity to chat.
Yeah, absolutely. Hopefully we can do it again. So thanks so much. And we'll sign off here. Thank you for listening. If you enjoyed this episode, it would really mean a lot to me if you would forward this episode along to any friends, family members, anyone that you think that would get value out of it and learn something important. The mission at Peak Performance is to help people prioritize and transform their health. And so if you think someone will get value, please, please, please do forward this episode along to them. Also, if you could please please rate and review and subscribe on whatever podcast player you are listening to this on. We would greatly appreciate that as well. It means a lot. And I want to tell you about a couple of new products that we just released. You can get 20% off your first order at buypeakperformance.com. That's BUY peakperformance.com. We just released a brand new grass-fed beef protein isolate. This is my favorite new protein powder because it's great for muscle building and recovering and all that kind of stuff, but it doesn't give the stomach discomfort and gas that a lot of people get from different types of proteins like whey protein. Some types of plant proteins can do the same as well. It seems to be really, really easy on the stomach while still giving all the great benefits of muscle building and everything else that you want from taking in adequate protein. So check out our new beef protein isolate. We have it in unflavored, which I actually mix and blend with my morning coffee every morning. We have a vanilla and we have a chocolate. You can buy it on Amazon, but again, you also do get 20% off your first order at buypeakperformance.com, BUY peakperformance.com. We've also recently released organic mushroom coffee. We have these in Keurig compatible K-cup coffee pods. We have organic mushroom coffee with lion's mane, reishi, cordyceps, turkey tail, and chaga mushrooms blended with the high altitude organic coffee that we've been using and that we've been famous for years. So that's been a big hit, that one as well. You can get on our website or Amazon, any of our products. And of course, we're always famous for our organic green superfood powder that has almost 5,000 reviews on Amazon with a very high star rating. We're known as the best tasting USDA certified organic green superfood powder with over 25 plus organic ingredients. Again, we also have the organic red superfood powder. We still, of course, have the organic plant protein for those who do prefer the plant protein, but I'm really excited about this new beef protein isolate and all of our other products. We do have over 100 products, so just check us out if you type in Peak Performance Supplements on Amazon or if you go to buypeakperformance.com. Thank you so much, and we'll talk to you again soon.